I want to talk for a little bit again more about the Finance Committee, because in the budgeting process, we carve out work groups, and because I chair the Senate's Health and Human Service Committee, I work on health and human service budget issues, and education chairman will work on those, and we kind of divvy it up and then come back together, and of course the Senate comes up with its budget, House comes up with its budget, and we mesh them together. The only thing that really saved our bacon this year, because this was a down economy, we did have less money. We went into session really worried about how we were going to make ends meet, and we were looking at some pretty significant cuts. And then the stimulus money started flowing. Now, there were many of us, no, not many, some of us, had real concerns about that stimulus money. In fact, I was the only member of the Finance Committee to vote against using any stimulus money, and I'll tell you why. When we had that presented to us on the Finance Committee, it was presented in a package, $16 billion, and this is $16 billion that we didn't plan on having, and that's a nice chunk of change. And the argument could be made, a good argument, that if we don't spend it, it's not like we get it back as taxpayers. It goes to California and Florida, and we don't get it. And so my philosophy was I don't necessarily disagree with taking stimulus money if I know that it's not creating a new program that once we start that, next session we're not going to have stimulus money, and now we've got a new program that we were going to have to find the money for. And during session especially, I wasn't at all convinced that the economy wasn't going to get even worse than it already was. I mean, I had two parents that were adults during the Great Depression, and that was just really rammed into me. You know, you need to tight buckle. That may be why I'm so fiscally conservative. Add that to my bio too. I was ranked the most fiscally conservative senator in the state of Texas again this year. But when the expenditure of the $16 billion was presented to the Finance Committee, it was presented to us in 10 pages. So this is a really high level of where we would spend this money, and not many details. And it was presented, and we were ready for a vote. And I said, wait a minute, can I ask some questions? Because I'd like some more detail about what kinds of programs we're talking about, and, you know, is this a one-time deal? I don't know. If you want to spend some money to expand some roads that we need, great, fine. The roads are there, but I really worry about some new programs that I know people were knocking on my door, wanted to have created, and I felt like it wasn't something we could afford. And I was told very abruptly that we needed to ram this through quickly so we could get on with business, and if I didn't like it, just vote against it. And I said, okay, I'll no. And I was the only no, but that's okay. We did end up spending a little bit less than that of the stimulus money. I think we ended up spending about $12 billion after the negotiations. But you're going to hear people bragging about we passed a budget with a very small increase in expenditures, and they're going to brag a lot, and I'm warning you that in 2 years, unless the economy really picks up quickly, we're going to be facing some really tough decisions, because some of that money did go for new programs that we're going to have to continue to fund. We also, I expect, in 2 years are going to be facing another school finance crisis. The Robin Hood plan was put into place, and then that was tinkered with, and now I'm hearing more and more talk by some school districts that are, and there really is a pretty diverse per student amount that's being expended in some of the, even within my own Senate district. And I'm hearing more and more that there could be some more lawsuits, and so we'll have to deal with that. The portion of the budget that I deal with, I'm going to alert you to the challenges that we face. The biggest single expenditure in our budget is Medicaid cost. And Medicaid cost, that pays for health care for those who can't afford it. Basically, it's the very young and the very old. And guess what two quadrants of our segments of our population are growing rapidly in Texas? The very young and the very old. And so you're going to see a dramatic increase over the next however many years. Since I have been on the Finance Committee, we've gone from 14% of the budget going to Medicaid costs to now 38% of the budget going to Medicaid costs. And that's going to continue to rise like that unless something changes. I have filed bills for Medicaid reform. I have done some great things to deal with that. You know, basically what you need to do is make sure two things. You need to make sure that people have access to health insurance rather than getting their health care in the emergency room of the hospital. And that's where a lot of these people are getting their health care, and it's the most expensive health care you can get. The other thing, and it really distresses me that in the federal health care reform legislation that's being discussed, they're really not talking about health care reform. They're talking about pay, you know, the money aspect of things. We need to be talking about taking care of our bodies. It amazes me. I asked our health commissioner one time, we were talking about healthcare costs rising and stuff, and I said, Commissioner, what percentage of the amount of money that the state of Texas spends for people who can't afford to take care of themselves is spent on treating illnesses or health care from accidents or whatever that are preventable? And I'll extend that even more with my own, you know, in our own personal lives. Just guess, ballpark. He said, we've had this discussion, and he estimated that about 70% of all of our healthcare costs could be taken away if we just did what our mothers told us to do. You know, wear your seatbelt, don't smoke, don't drink in excess, don't eat every meal at McDonald's, wash your hands, all those things. We could save 70% of our healthcare costs, and we'd be healthier. We spend a huge amount of money treating illnesses that are obesity related. I have been, if you followed me at all in the press, I have been just fixated on children's obesity. If, you know, I don't know, adults, maybe we should give up. Ken Cooper's been helping me with some of my legislation. He's at Cooper Clinic in Dallas, and he invented the term aerobics. And Ken Cooper came into my office a couple years ago to help him with, I carried a bill that was a great bill that focused on childhood obesity, and he said, you know what, I'm giving up on adults. It's really, you aren't going to change them. They're just going to keep doing things wrong, but we can't lose the kids. 40% of all children under the age of 5 in this state are obese. Those are little kids that should be out exercising, and you know, and those kids are doomed. And there's some reasons for that. I had a bill I found out about, and it was in Lewisville, maybe 8 years ago. I got a call from a mama. I love just, you know, if I'm in my office, I take my calls. And this mom was really angry, and she said, I have a second grader who is sitting at his desk all day long. He gets 30 minutes for lunch, and he has no recess, no PE, and he's sitting at his desk. And I said, no, they have PE. She said, no, they don't. And I called our superintendent here and asked, and he said, no, you guys got rid of it. I said, we did. It turns out when we rewrote the education code, either on purpose or inadvertently, the requirement that elementary schools teach PE was taken out. So I thought, okay, this is easy. I'm going to put it back in. And I filed a bill. Holy cow, that was one of the toughest bills I've ever had. In fact, I didn't pass it the first time I filed it. Came back with it modified the second time, and the reason was that the educator, well, I won't say all educators, but there were those who fought the bill who thought that that's time that kids could be studying for the tests that we give these kids, and they do better on the test. Let me tell you, the Greeks were right. Sound body, sound mind.